recognized for 5 minutes.
Thank you, Mr. Chairman, and I thank our witnesses for being here today. Ms. Roberts, we've talked about how the law imposes reporting requirements on employers regarding the coverage they offer and to whom. It's my understanding that many of the requirements relate to information that employers may not have recorded and maintained previously, at least not in administering health care benefits. I would like to ask you to describe for the committee your experience, what your experiences have been in complying with the health care law's reporting requirements. If you could talk about the types of investments in human resources and information technology that you've had to make to comply with the requirements. Can you tell us about the considerable time and money spent on complying with the ACA reporting rules? And will they have produced any beneficial effect on any of your employees?
Yes, knowing that the reporting requirements were going to begin for the 2015 plan year, we started researching the requirements of reporting last year at least. The IRS did come out with their draft forms in July, and we've anxiously been waiting for the guidelines ever since. They were released in February. So since that time, we have been looking into the exact reporting requirements. Much of the information we have in our systems, our current systems. However, it is a matter of integrating those systems, time systems, payroll systems, and generating information in the format that the IRS is requiring. Some of the information that's required we don't have on our premises, believe it or not. It's with our third-party administrators, such as the former employees who are on COBRA. We must supply information, employee names and social security numbers, et cetera, but also codes that we have not factored in before. For example, why they are not on our benefits. So this is going to take some time in reprogramming our systems, setting up codes, and it does take time for evaluating, pulling the information and evaluating the hours worked and making sure we're recognizing those benefits eligible employees properly.
Thank you. As somebody who, in my life in education, had to spend a lot of time on evaluation, I'm really very familiar about what a problem it is after you've begun a program to try to go back and gather information when you have not put into your program the kind of codes, as you say, that now the government is requiring. And that can be a real headache. So thank you for describing it in just bare terms. We appreciate it. Mr. Paul, would you like to add anything to what Ms. Roberts is saying about tracking the necessary data that you're going to need to comply with the IRS requirements? You've got, I think, outside groups helping you with what you do, but have you had any useful guidance from the administration? What are you hearing from others in your industry about the compliance effort needed for these reporting requirements?
What we're hearing on the requirements is been changing consistently over the past several years. It's what are we to do this time? Well, what's it going to be next year? The most recent thing that we were able to do is to track everything. We got the raw data, and we figure with that raw data we can put it into any kind of report that somebody wants. Of course, when we're trying to reach out to our tax professionals in tax season, they don't want to call about what kind of health care reporting they want at the end of the year. But we rely heavily on our professional advisors, our attorneys and our accountants. But again, these folks charge by the hour. So, the more we use them for that, the more it costs us on the bottom line to comply. So it's a combination of time and cost.
Thank you very much. I yield back, Mr. Chairman.
Thank you, gentlelady, for yielding.